Stay informed about the COVID-19 pandemic. The global pandemic known as COVID-19 is continuously being monitored by the World Health Organization and other organizations across the world. In this video we have a list of Q&As that will help you during these trying times. If you are new here or have not subscribed to this channel, do like, comment, subscribe and click the bell icon to receive updates of my health videos. What exactly is coronavirus? The term coronavirus refers to an entire family of viruses known to cause illness in both humans and animals. When focusing on humans, the viruses are responsible for respiratory infections that range from having a common cold to even more severe cases such as the Middle East Respiratory Syndrome (MERS) and the deadly severe acute respiratory syndrome (SARS). The latest coronavirus, which wreaked havoc in Wuhan, China and is now spreading across the world like wildfire, is the COVID-19 infection. What does COVID-19 stand for? COVID-19 stands for Coronavirus Disease 2019. COVID-19 is a type of infectious disease that is caused by the newly discovered coronavirus. COVID-19 is considered a zoonosis by some, having possibly originated in bats and infected humans through a chance mutation. The disease has been unknown to the world before it hit the town of Wuhan in China back in December 2019, and hence the name COVID-19. What are the COVID-19 symptoms to watch out for? The three most common signs to be aware of when dealing with the COVID-19 are tiredness, dry cough, and fever. Some patients might experience aches, runny nose, diarrhea, and nasal congestion. The symptoms mentioned are usually mild and often increase gradually. Some individuals have the disease but don't exhibit any symptoms. Such people don't feel unwell even though they are infected. It is important to note that about 80% of those infected often recover without requiring any form of special treatment. The elderly and those patients who already have any underlying chronic diseases usually become severely ill. Such illnesses include diabetes, hypertension and heart problems among others. You should seek medical assistance if you have a fever, develop a cough or have difficulty breathing. How does the spreading of COVID-19 occur? One can catch COVID-19 from someone who is already infected. The virus usually spreads from one individual to another through the transfer of small droplets that originate from the nose or mouth when the infected person coughs or exhales. The droplets then find their way to objects and surfaces found around another person. When anyone touches the infected surfaces or objects and then touch their mouth or nose, they become infected. You can also get infected with COVID-19 if you directly breathe the droplets from an infected person who coughs or exhales near you. This is the importance of keeping the 1 meter distance between you and other people. COVID-19 disease is mainly spread through droplets and not the air. Can the feces of an infected person spread the disease? According to the World Health Organization, the risk of being infected from the feces of someone with the virus is low, but there is definitely a possibility. Initial investigations reveal that feces may possibly act as a mode of spread in some instances. This is why it is advised that you wash your hands with soap regularly after going to the toilet or before a meal. Can you get COVID-19 from someone with no symptoms? The risk of being infected with the coronavirus from someone with no symptoms is quite low, but it is still possible. Most people who have COVID-19 show mild symptoms, especially during the early stages of the infection. How to protect yourself from COVID-19? The best way of reducing the risk of infection is by adhering to the following tips. Tip number 1: you should wash your hands thoroughly with soap and water or use an alcohol-based hand sanitizer. This practice kills germs that might be found in your hands. Tip number 2: apply social distancing as you go about your daily activities. This means that you should maintain a safe distance of 1 meter between you and other people at all times. This will help prevent the droplets released when an infected person coughs or sneezes near you. Tip number 3: it is important to avoid touching your eyes, mouth, and nose. Your hands might pick up viruses from objects and surfaces which might be transferred to your mouth, nose or eyes, hence putting you at risk of being infected. Tip number 4: adhere to proper respiratory hygiene. This means that you should cover your mouth and nose by using a bent elbow when you sneeze or cough. This is because droplets are the main way in which the virus is spread from one person to another. Tip number 5, if you feel unwell, then it is recommended that you stay at home. However, if you experience fever, difficulty breathing or coughing, then seek medical assistance immediately. You should stay updated with information regarding COVID-19 by avoiding hotspots, especially if you are elderly or suffering from an already existing disease like diabetes, hypertension, heart, kidney, liver or other systemic ailments. What is the incubation period of COVID-19? The incubation period is estimated to be between 1 to 14 days, with symptoms mostly appearing after 5 days. But there have been instances where cases have been reported even after the purported 14 days incubation period, suggesting a possibly longer incubation period. What is the effectiveness of using antibiotics, antivirals and antimalarials against COVID-19? Antibiotics and antimalarials are incapable of working against viruses because they are designed for bacterial infections. This means that antibiotics and antimalarials cannot be used to prevent or treat the virus. The effectiveness of the antimalarial drug, hydroxychloroquine, and even antivirals in the treatment and prevention of COVID-19 are anecdotal and are fraught with dangerous, even life-threatening adverse effects. While their possible use in COVID-19 have been studied in vitro and in animal studies, there are no authenticated clinical trials to prove their application in a clinical setting. Thank you for watching this video. Before you leave, remember, sharing is caring. If you enjoyed this video, please like, comment and share it. Remember to subscribe to this channel and click the notification bell to receive every single update. For more content like this, visit www.medicalisland.net. Finally, remember to take care of yourself and your loved ones during this pandemic. Wear a mask. Wash your hands frequently with soap and water for at least 20 seconds. Avoid touching your face. Practice safe distancing and work from home if possible. Stay away from your elderly folk, especially those with pre-existing ailments. Be safe, keep your loved ones safer. Check out other cool videos on my channel. If you are interested in a healthy you will subscribe to my channel right now.